Older adults are the most likely to use prescription medications, but many are also taking non-prescription drugs like aspirin and vitamin supplements at the same time. Now that can put them at risk for hazardous drug interactions. Here's what you need to know to prevent them.
They're common prescription and non-prescription medications, but when taken in combination, they can cause problems for the most vulnerable among us, older adults.
The number of medications older adults are taking are increasing, and we worry about the potential interactions between these drugs because they may have some safety implications for older adults.
Combining drugs can result in internal bleeding, among other serious problems.
Combinations of medications may reduce the effectiveness of one or the other medication.
Researchers at the University of Chicago Medical Center decided to look at medication use among older adults.
No one has ever really documented how many medications, what types of medications older people use on such a large scale, including non-prescription drugs along with prescription drugs.
The study analyzed data collected from over 3,000 people, ages 57 to 85, about use of prescription drugs like blood thinners, over-the-counter drugs such as aspirin and vitamins, and herbal supplements like ginkgo biloba. The study found nearly 1 in 25 people, 4%, were at risk for hazardous drug interactions.
One of the important findings is that specifically for older men, ages 75 to 85, 1 in 10 were using combinations of drugs that put them at risk for a severe medication interaction.
Researchers recommend that doctors and pharmacists be careful when prescribing and dispensing drugs, and that patients take precautions too.
They have to make sure they discuss all their medications with their physician and their pharmacist.
Not only the prescription medications, but also the medications they buy over the counter.
Because when it comes to medication use, being careful can be critical.
Now, the study showed a lot of people are at risk, with 81% of participants using at least one prescription medication and 61% of those taking the prescription drugs also taking over-the-counter medications.
When you think health, think IRU.